This is Dr. Scott Geller, eye floater laser specialist out of Fort Myers, Florida. We've been doing this for well over 25 years with 20,000 laser sessions, the largest continuous clinical series worldwide. I'm going to discuss an interesting case here. This patient had a hyaloid membrane. It's a little different than the average floater. Initially, we always tell the patient that they have a problem. This patient had a very small cataract, but if you look into the eye, and we're using a CGV contact glass from Lazog and using the Lazog microruptor laser, which is the very best on the market, made in Switzerland. There's very few of us who practice this procedure worldwide who actually have this unit. And I find it the best. I've tried them all. The strategy here is something that you develop while you're looking at the opacity. I'm looking at the Weiss ring hyaloid opacity here and the thickened hyaloid membrane from a posterior vitreous detachment. Our strategy is to cut the Weiss ring away from the hyaloid, creating a window. The window will retract both laterally and medially, allowing the patient to see clearly again. And this patient is a phakic patient in his 50s. He was offered a vitrectomy, did not want to proceed because of the problems of cataract and other possible complications with vitrectomy, which are very, very rare in my hands with laser vitreolysis. In this case, we're speeding it up a little bit for the video. The Lazog laser has a burst mode of 5 to 9. We're using a 5-shot burst here with a power of about 5 millijoules per burst. You can see here we're gradually cutting away the thickened hyaloid membrane from the Weiss ring type opacity, creating a window. This is a little more difficult than most ophthalmologists would think. It does take up to 4 sessions minimally. We know it did in this particular case, but the average case that I've done takes 2 to 4 sessions. Any ophthalmologist who says this can be easily done in 1 session really doesn't have a good handle on it. And there's a lot of colleagues out there who are a bit inexperienced because there are no good training facilities available for this. I went to Switzerland, learned the technique there on diabetic membranes, and brought it back to the United States, and we were the first facility to start doing this on a continuous clinical basis. We're continuing to cut the vitreous membrane here. It does take quite a bit of time to do this. And the goal is to, again, create a nice window and ultimately clean up all the debris. There will be a lot of debris from a case like this, and this is the main reason you have to go back and do at least 4 laser sessions. There's a limit to the amount of energy you want to put in for safety purposes. There are complications from too much energy in 1 session. That's something that we teach our students who come to us to learn the technique. This is Dr. Scott Geller signing off. We'll have more videos for you shortly. Thank you for listening.